Hey everyone, on today's Be Healthistic, we're doing a special Ask the Doctor segment where we answer your questions. Today's question is, I've heard that taking antacids every day can be bad for my stomach. Do you recommend them? And if not, what do you recommend in their place? Yes, antacids are lifesavers for people in terms of like an acute situation where they're in a lot of discomfort. They might be having some indigestion, some heartburn, and they take something like Tums, which is really calcium carbonate, and it really helps neutralize the acid in their stomach and can really help with those symptoms of, indigestion. So if people are in a pinch and they really need something acute really quickly to kind of help calm down those symptoms, yes, something like an acid can help to alleviate those symptoms. Now, I don't recommend them long term though, because when you take an antacid, you're essentially suppressing the digestive function in your body. And that's not good. With anything that you do, a medication or a supplement, you don't want to suppress a pathway in the system. And with antacids, you're really suppressing acid, use. And your body needs acid. It needs hydrochloric acid to break down food. So if you suppress that function, there's going to be consequences downstream. And some of those consequences can be increased bloating or burping or increased gas or even diarrhea or constipation. So again, short-term use, okay. Long-term use, they can really kind of lead to side effects as those symptoms I just mentioned. So you really don't want to be taking them long-term. Now, the bigger question here is what's causing that indigestion or that heartburn for someone. And there's many different factors. There's lots of, stress that we experience on a daily basis, stress when we're eating our food, we're watching the news or something and we get a bad text or whatever it is. And we say to ourselves, oh my God, but yet you're eating food in that moment, you're not going to be digesting your food all that well. So you really kind of have to calm down a lot of the stress in your life in order to really optimize digestion and prevent something like heartburn. I've mentioned before that chewing your food is really, really important. And I cannot emphasize that enough because I've seen so many cases of people coming in where they have indigestion, they have heartburn, and all I do is really tell them to go home and make sure you're chewing every bite or every mouthful about 20 times. And sometimes I've had people come back without even giving them anything else. And that's been something that's helped correct their indigestion. So make sure you chew your food because that's when really digestion begins, is when you're chewing your food, and that starts the whole digestive process. Now, there's certain supplements that you can take to kind of calm down an unhappy stomach or indigestion. And that can be, supplements like glutamine, or there's demulcent botanical medicines like slippery elm or marshmallow root. There's aloe you can take. There's DGL, which is from licorice root. These are all herbs that kind of calm down an angry stomach, for that matter. So after you've chewed your food thoroughly, you sat down and you're present with your food and you're eating it slowly. After your meal, I encourage you to go for a walk afterward. You can go into your neighborhood. If there's a nice trail behind your home or something like that, even better, because then you're immersed in nature. But that's a great way to move your body after you eat, which can actually help facilitate blood flow and help you digest your food as well. So do calming things before, during, and after you eat, because that's really what you need to do to support optimal digestion, is to support the nervous system, which we've talked about before. So I hope you learned a lot today, and we'll talk to you shortly.